Hello, everyone. I am a volunteer with For a Safer Space. Today's presentation is about adult attention deficit hyperactivity disorder. I would like to begin this presentation with a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as Toronto Metropolitan University. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Today's agenda will include an introduction about adult attention deficit hyperactivity disorder, followed by the diagnosis, challenges, treatment, and lastly, the conclusion. What is adult ADHD? Adult attention deficit hyperactivity disorder is a mental health disorder characterized by a combination of persistent problems such as inattention, hyperactivity, and impulsivity. Adult ADHD can result in unstable relationships, poor work or school performance, low self-esteem, and other issues. Though it is referred to as adult ADHD, symptoms begin in childhood and continue into teen years and adulthood. In some cases, ADHD is not recognized or diagnosed until the person is an adult. Adult ADHD symptoms may not be as evident as ADHD symptoms in children. Adults may experience less hyperactivity, but they may still struggle with impulsiveness, restlessness, and inattention. Why is it hard to diagnose ADHD in adults? These reasons include attentional or behavioral issues can result from other mental illnesses. For instance, some mood disorders can make it difficult to concentrate, some anxiety disorders can make it difficult to sleep, and some personality disorders can make it difficult to control one's impulsivity. Although it is improving, clinicians may not have the necessary training to identify adult ADHD. Adults can create coping mechanisms that mask their symptoms. Adults who experience extreme restlessness, for instance, may opt for a job that is busy, fast-paced, or change jobs frequently. Challenges. These challenges may have a significant impact on adults with ADHD, or they may not. They can be a reoccurring issue or just depends on the situation. Adults with ADHD may struggle with anxiety, chronic boredom, chronic lateness and forgetfulness, depression, trouble concentrating when reading, trouble controlling anger, problems at work, impulsiveness, low tolerance for frustration, low self-esteem, mood swings, poor organizational skills, procrastination, relationship problems, substance abuse or addiction, and low motivation. Treatment. Adult ADHD treatment plans include medication, behavioral, psychological, educational, and coaching interventions. A person with mild ADHD may want to look into cognitive behavioral therapy or consult a professional organizer. They teach a person to organize oneself, stick to their plans, and complete tasks that they begin. Certain healthy habits will also help to prepare a person's body to deal with challenges. These are some examples of healthy habits: coping with stress, consuming a well-balanced diet, and regularly getting enough sleep. Now we'll go over resources. The most important thing to take away from this video is that there's support and help available. For an immediate mental health crisis, Reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you'd like to reach out for support. That concludes the presentation on attention deficit hyperactivity disorder in adults. Thank you for watching.